Welcome back. Well, if you could name a part of the body that helps aid in your metabolism, your energy, and well, basically just your overall health, well, what body part would that be? Well, if you happen to guess your thyroid, then you guessed right. It turns out the thyroid is behind a lot of different health conditions that often get overlooked. Well, here to tell us all about it is Destiny Petrowicz. She's with Premier U. Destiny, welcome back to the show.
Thanks for having me.
Of course, we are talking about the thyroid today. Apparently, that's responsible for a lot of things that are happening here. Why is it so important? What's it do?
The thyroid it's actually a really small gland that's located right here on the base of your neck.
Okay.
But the reason why the thyroid is so important is because it's responsible for energy production and utilization in the body. So it's responsible for how fast or how slow our metabolism works. And because of that, it regulates a lot of processes that our bodies do.
Okay, well that's fair. And I think, you know, whenever a woman hits about 44, her thyroid shrinks up and turns into a raisin. I'm not sure, guys. What do you think?
I love that.
Actually, it's important for all of us, right?
Yeah.
Now, what are some of the most common signs that your thyroid might be out of whack?
Well, you know, you can have two kind of varying ends of the thyroid. You can have overactive and underactive.
Okay.
And so we think of this like an overactive thyroid is going to be everything is ramped up, right? So we see people have anxiety or weight loss or tremors or heart palpitations, right?
Okay.
Everything's working too fast. Underactive thyroid is the exact opposite. Everything is sluggish and slowed down. So we see weight gain. Sometimes we see depression. We see constipation or, you know, just everybody feeling bleh with that. So we see, you know, these conditions affecting a lot of people, not even realizing that their symptoms are related to their thyroid.
Is there a certain person who might be affected by the thyroid more than another? Like, is there a certain demographic?
Yeah, you already kind of hit the nail on the head with that.
Oh, well, surprise.
Women, it affects more. It
Yeah.
still affects men and, you know, and children, but with women, the significant hormonal changes that we see with pregnancies, with menopause, you know, those really have an effect on thyroid function.
Well, I mean, whenever you're coming out of pregnancy or you are experiencing perimenopause, I mean, you're all over the place.
Yes.
It's not just your hormones. I mean, is it your thyroid then?
Yes,
that's at work?
absolutely. It plays a huge part there. And sometimes we see people after big hormonal changes, their thyroid never returns back to their baseline.
Okay, and I've heard women complain about that. Why can't I get back to the way that I was, you know, insert said life event, right? And it could in fact be their thyroid.
Absolutely.
Okay, well, how do you get that diagnosed? I know that, I mean, it kind of sounds like similar complaints that could be associated with many different conditions. So how do you narrow it down to the thyroid?
And you're right, it often gets overlooked because of that and that overlap. So,
I can see that.
you know, the true diagnosis, it comes with lab work. And it's pretty easy to get the diagnosis. You know, my recommendation would be to, you know, if these symptoms are present and they're persistent, to advocate for yourself and for your health and to be able to talk to a medical provider that's going to do a thorough lab evaluation and get you the help that you need. It's a very treatable condition.
Okay, so some blood work, you can get some answers, but then what? What is the next step there, Destiny?
Yeah, really, you know, sometimes it's just supplemental support. Sometimes we need medications. You know, sometimes it's dietary or lifestyle interventions. But, you know, having a provider who is very knowledgeable on the thyroid is the key component there. That's something that I, as a PA at Premier U, I love to treat. I oftentimes find missed thyroid diseases, and I can really help people optimize their health by optimizing their thyroid.
Absolutely. I mean, I'm sure that you've heard once or twice from a patient, we've been through so many different things. I'm glad you finally were able to narrow it down to this.
Absolutely. We hear it all the time, and it's a breath of relief for most people. Of course, you don't want to find something wrong, but when you do, you can feel better.
Yeah, and you can find a way to try to solve it.
Absolutely.
All right. Well, Destiny, before we go, is there anything else you'd like to add?
I would, you know, just add for patients to advocate for yourself, for your health. If you don't feel like you or, you know, don't feel right, to, you know, reach out to your provider. If you're looking for a provider, Premier U of Marion is here.
All right, Destiny, thank you so much. And thank you for kind of giving us some, well, a little bit of answer to some of those random symptoms that we might be experiencing. At least now we've got thyroid on our radar.
Absolutely.
Okay, thanks a lot, Destiny.
Thank you.